Next, we'll move on to our final item on the agenda, which is a presentation regarding emergency medical services staffing's process, including general staffing, recruitment and hiring process, and solutions for longevity and staffing. Staff's ready to present.
Yes, thank you, Chair Kelly. Interim Chief Jasper Brown, Austin Travis County EMS. And welcome, Councilmember Abella, and congratulations on your election. So first of all, I'd just like to go over our department staffing. We have 664 authorized strength. That's what's authorized by the council to be hired into. There are 540 filled personnel, and that leaves us with vacancies of 124. Now, out of that 124, what we called medic openings, that's our lowest level, our entry level into the department. There's 47 of those. Those are what we can actually hire into without going through a promotional process. So 77 of the sworn positions open are promotions eligible, 70 of those being our field clinical specialist rank. So that's really the kind of the pinch point for us. I only have a limited number I can hire into, and then I have to rely on promotions to then move the personnel up so we can hire more into the department. We just recently graduated a class on this Monday, actually. That was scheduled for Friday, but it got canceled for the Zeiss. So we just graduated the class on Monday. There was 11 cadets that will transition from civilian to sworn. So that'll affect that 47 right there. So it'll change to about 36. And that class started earlier than scheduled. We weren't really going to start that class until January, but we made a decision back in October, November to move that up in our hiring process. So we shortened the process, moved up the date from January 24th start date to December 1, which caused some people to drop out of the process, and we actually had 4 medics defer to this next academy because they weren't ready to come at that time. They either had leases, families, or other things they had to move and couldn't move in that short of time. So we had less cadets than normal, but it was, we made a decision to go, let's go faster and get some people in instead of waiting till January and then waiting another 8 weeks till they graduated. Next slide, please. So just to kind of understand how we got to 124 vacancies, the green numbers are our attrition levels. I know there's been a lot, red is our attrition levels. I know there's been a lot of talk about attrition last year. That wasn't our highest attrition over the last 6 years. If you'll notice in 15 and 16, we actually had more people separate the department than last year. The difference in those 3 years is in 15 and 16, we had 3 people in each year retire. Last year, we had 24 of those 53 people retired. That means the 23 plus years, several of them were 28, 29, 30 years with the department. In the green, you can see what we actually hired through the cadet classes coming in. And so it actually looks pretty good as far as how we're hiring versus our attrition or separation rate. Next slide, please. This is the same graph, but with some additional information and context. The blue is, again, the attrition level, and then the orange is what has been added by council through requests either we've made or other people have made to add positions to our department. So last year we did lose 53, but we added 67 positions to the department. So that's a total of 120 vacancies to fill. You'll go to the next slide, please. So when you look at that now, that our chart doesn't look so good. There was only 1 year we actually hired more people than we could have hired into the department. So this is kind of a 6-year, 7-year issue we've gotten to where it's now we have 124 vacancies. This year we only have 25 additional positions to fill into, and we're already starting an academy in March. So I feel we're going to be much more on the positive side this year. Since those positions, we won't have any additional positions this fiscal year that's already accounted for in the 25. Next slide, please. In our recruitment hiring process, our next academy already starts on March 28th. Those cadets are already being offered positions. That's why I put 27 more or less, because we might have a few that either defer or turn down our offer, but we'll be offering 27 total cadets. There's 23 current applicants and 4 cadets that I spoke of earlier that defer to the next or to this academy. We have a hiring process open currently that started on January 31st and will end at the end of February, and that academy is scheduled to start in July. So again, I only have about 40-ish vacancies to hire into, and as promotions occur, have more, but we already have processes in place to fill those in as we go. Next slide, please. The promotion process I spoke of is for the next field clinical specialist is in May. There's 70 of those vacancies. We have to post for 90 days through the civil service in contract by Civil Service in 143. So we're posting the materials now. The test is scheduled for early May. I believe the date's May 5th. That's being locked down as we speak. After the promotional process and the testing, any challenges to questions, then we'll create a list. Those individuals will be promoted into the 70 vacancies. And then after that, there's a 14-week advanced life support class required for promotion by the Office of the Chief Medical Officer, which gives them their credential to practice at the ALS advanced life support level. So for those 70 vacancies, I have 59 medics who currently hold a paramedic certification. They have to be paramedics to be able to be promoted into clinical specialists. Out of those 59, there's probably about 20 to 25 that have not set for a test at all since they've come into the department for whatever reason. They've chosen not to move up. They're comfortable with where they're at, their process, everything. So there's not 59 people sitting for each test every time we go. We have 20 individuals, medics, enrolled through our internal paramedic course that will take them from being either an EMT or an advanced EMT to become a paramedic. But that process takes about 18 months, and that class just started here in January, so we won't see the results of those till the following year. In the meantime, we're still hiring. We hire paramedics. We try to get paramedics in, and as we go through our hiring process, and there's advantages for paramedics that move them up the list higher, and there also is a paramedic stipend for as they come into the department currently under our contract. And
Real
I'll
quick,
pause.
if we'll pause for just a moment,
Yeah.
Councilmember Kitchen has a question.
Just a
Yes,
very
ma'am.
quick question. I'm not on the committee, but thank you for allowing me to do that because I have to step away. But can you remind me whether the community health paramedics are included in these numbers?
They are.
Okay. Do you have, and I'm sorry, I don't even know, is that like, are the community health paramedics like a separate designation? In other words, can you break down the numbers that you have in terms of vacancies and that sort of thing to let me know how the community health paramedics are working, or do you have the data that way?
I pretty much know off the top of my head that the two packages that were passed in the last
Yeah.
process, I think there were 7 clinical specialists each. There was one by, I think, yours and one by, can't remember, Councilmember Alters maybe. There's 2 different community health paramedic.
Yeah.
They're not separate, they're all in, they're just clinical specialists.
Okay,
Those 14 are part of the 14 or 70 vacancies.
okay,
The only way for me to fill them and move them over, and we do have people interested to move over, is I have to pull from my field. And if I pull from the field, I can't staff the units that are designated for the streets.
Okay.
So probably about 4 years back, when I think you helped us first invest in the community, those CHPs, community health paramedics, are filled, but it's the additional, I think, 14 we have not filled yet.
okay, thank you. That's what I thought. I just wanted to double check that.
Yes, ma'am.
Thank you so much, Councilmember Kitchen, for being here today and for asking that really important question. Go ahead and continue. Thanks.
We go back to the presentation, please. Just make sure. Go to the next slide, please. So in longevity, as far as what we can do, obviously, filling vacancies and reducing unwanted overtime is the key to everything. We're currently negotiating an EMS contract for the next 4 years. So our current contract ends in September. Been working closely with the team and Devin Desai from our Labor Relations Office. We feel very positive about the contract. I can only probably discuss what is only in open forums, but I think there will be good things that come out of it that will bring people in that who maybe have hesitated in the past to come work for us because of one reason or another. One of the things that has been talked about in public, and we discussed it in a previous contract request, was to hire straight into that promotional rank. Obviously, there will be a lot of things that need to be worked out as part of that, and we are hopeful that that'll be a part of the contract, because we certainly don't want to block promotions for the people that are here today, and that, so that they'll have the opportunity to promote. But with 70 vacancies, we do need to close the gap some way or another. As far as the longevity, the schedule that was adopted earlier than originally intended, it was, our 24/72 schedule was only going to go into existence this fiscal year. Council made an investment in the previous fiscal year, and we started the 24/72 schedule, which means the medics work, for the majority of them, work 1 day on and have 3 days off. Now, we do have what we call on-call in between, where they're having to come in on those days off. We're doing everything we can to reduce that unwanted extra overtime that's necessary to keep our trucks up and running. So as far as that context, reducing mandatory overtime, we currently have started what we call a pilot program of incentivizing volunteerism, and that has gone really well. We started it January 15th. We're running it currently through April 15th, and we'll evaluate as we go along to see whether it stays or continues. But what we're doing is we're paying extra for people who actually volunteer, not coming off of any other kind of list or anything. And so we're trying to incentivize those who really want to work and not those who are either scheduled or don't want to work. So far, it's been very positive. We've reduced our amount of people we're having to call in off or on call. And we think it's going to be a positive step forward. We'll see the results of it in the program. Next slide, please. The other thing we need to work on as we continue going along is a fatigue management plan, and that's basically balancing the system to make sure that we have the best utilization of all our units out on the street, so that not one unit is overworked or has more workload than another. And so some of that's through ambulance relocations. We have several stations going under construction. We're having to either relocate them or put them on trailers on site. And once those stations are finished, we'll be able to add additional units to those stations. Examples are our EMS Medic 1, which is on South 1st Street right at Ben White, or our Medic 5 station, which is across from the DPS headquarters on North Lamar. Both of those are going under renovations, and they'll be able to house additional units once they're completely done. And so once we do that, we really feel like if we can balance the system better, the units that are on will have less workload, and they'll be able to get more downtime, relaxation, and be able to complete their necessary reports and other things that are critical for our systems. And of course, reducing call volume. Part of that is risk reduction, and that's what we saw in our dispatch equity and optimization study. There was definitely several comments about coordinating better with Austin Public Health, Austin Fire Department, and other partners to make sure our risk reduction programs are coordinated and targeted. Because if we can keep somebody from falling in the home or other things through better managing their diabetes or other issues, then we can keep them from calling 911, reducing responses and things like that. Again, Austin Fire Department has some excellent programs. We do. Austin Public Health, we need to coordinate better and manage those so we have really focused, targeted programs. Low priority calls, we've already started doing this through telehealth with the Office of the Chief Medical Officer and the public and the PAs and additional physicians they have. A lot of our low priority calls now, units when they get on scene are able to do telehealth to the doc and disposition those calls and not have to take them to a hospital. We want to get to a point where we're actually not even sending a unit, and then those are handled through telehealth, which will reduce the number of low priority calls. And then we're also triaging and managing through our paramedic consult line, which we started up under when the pandemic started. It was primarily to handle the pandemic calls of COVID and handling patients and keeping them at home. And we saw success in that. Council invested in that. And through other low priority calls that can't be managed through telehealth, they can also be managed through our paramedic consult line, which will reduce the call volume for our units. So really feel like some of those will be key issues in reducing the call volume for our units and reducing the workload for our staff. Next slide, please, I think. Yeah, maybe. That's the last one? Yeah, that's the last one, I'm sorry. I'll take any questions you have or comments.
That was great. Thank you very much. Colleagues, do you have any questions? I want to recognize that Councilmember Alter has joined us and Councilmember Kitchen has had to take off. Do we have any questions? Councilmember Alter?
So I missed the very beginning, so I just want to make sure that I'm clearly understanding. We currently have 124 vacancies, which to some degree is because of retirements and the additional positions that were given. Those positions are at different ranks. And so you can't fill them, you can't fill a clinical specialist with a new recruit. They have to go through the various trainings and steps. Tell me again when you will, because as soon as you fill the clinical specialist, you're going to have more vacancies at the medics that you're going to have to fill with the academy. And I'm just not quite seeing the timing of when we get more fully staffed. So can you help me understand that and what the assumptions are about retention in the meantime?
Yes, ma'am. So you're correct in the assessment of actually where we got to today. We currently have a promotion process scheduled, and it'll occur on May 5th. We can only do one process at a time, so as soon as that one occurs, and however many sit for that test, and we'll immediately promote them. The list is, we exhaust the list every time we have one of these, the civil service list that's created from the promotion process, and those will eat into the 70 vacancies. Those will create medic positions. Then we can hire medic positions into that. So it is kind of a domino effect right now. So this next class will close the gap probably almost in half. We'll probably only have less than 15 openings to fill into, and we're still hiring for that July class. So it'll be critical for the May promotion process that we create more vacancies out of the medic ranks in order to hire more people into the department. That's why we're really looking into, and the associations really has discussed openly and in support of it, is hiring directly into the clinical specialist. If we can do that, we'll be able to close that gap quicker than we can through this hiring them, going through a promotion process, and then hiring, and then a promotion process. So we really, hopefully, that will make it into the contract, and we're really looking forward to that opportunity.
Okay, so the piece that I'm missing here is when the medics promote to clinical specialists and there are additional openings, when you say you've cut the amount in half, that is the openings at the medic level,
Yes,
correct?
that's the 47 I'm talking about, and the 11 that just graduated. They'll make that 36 now.
Okay.
And we have 24 entering into our or 27 into our next academy. We don't lose a lot in our academy, maybe one. So if 25 come out of the academy, that's going to drop us down to 11 openings. That's all I can hire into. And so it'll be critical for that May test to promote people so we have enough to hire into for the July academy.
Okay, but in a perfect world, if all 59 of your clinical specialists promoted, or your medics promoted who were eligible, you would still need several classes to catch up.
Yes, ma'am. But I would only, we have 70 positions, that would only fill 59 of them. And about 25 of those 59 have never sat for a test in the past. We've, talked to them, encouraged them. Many of them are very happy in the level they're at right now, or have chosen not to advance, and that's okay. People can, choose to work the level they want to work.
Okay, and so we're trying to solve the gaps at the clinical specialist by hiring in at that level, and that's part of the negotiations with the association and everyone kind of agrees on that part. For the medics, then, so you don't know how much that gap is going to be, but so right now you can really only go a couple classes out.
Not sure I understand the question, Ms. Salter.
So you don't know how many of your medics are going to promote to the clinical specialist level. You can't predict the full trajectory for your classes.
That is correct.
And when we would be.
That's correct. We had 25 sit for the last test and only 15 passed the test. I'm hopeful those 10 that didn't pass will sit for the next one. Some choose to, some don't. We actively encourage. We've been working with OCMO to make sure we're, telling people, what do you need? Do you need help studying? It's important to, promote. We really need you as the paramedics to work in ALS role. So we're, doing everything we can to actively encourage people to sit for the test. It is a studying process they have to go through, and it is something that is part of civil service. You have to sit for the test and take the test.
Okay. And then there's another piece here I wanted to clarify. What are you assuming for retention or for attrition during that period? Because that's just the numbers of where we are now without losing anybody else.
So we're assuming about 8 to 10% attrition. That's what's occurred in the past. And that seems to be right on track of where we're at month by month, is about 8 to 10% attrition of current people filled in seats.
Okay, but if I was trying to get my 124 down, the attrition would be on top of that.
That would be on top of that this year. If we tried to fill 124, we're likely to lose another 40 to 50 this year. And so we would have to fill 170 to get to fill this year.
And those 40 could be at all sorts of ranks, and then you have to.
Exactly. Most of the people that are retiring are at captain, commander level ranks because they've been in the organization 23, 25, 27, 8 years.
So did we have a bubble the same way we had with police at the same time about, or is it just that's when they can retire with full benefits?
I'm not sure about the bubble in the police department you're speaking of.
Well, they had a very large class, and so the number of retirements,
Right. So I
number of
think,
people who are hitting that point when they can retire was high.
I think the difference, and I'm not going to speak out of turn for either the police department or the fire department, is a large portion of their vacancies are always at the entry level because they promote and have plenty of people to promote. But with mine, it's at that promoted level, which makes it more challenging because I have to wait for people to sit through and get the promotion to create vacancies for me to hire in. I would imagine the fire departments, all their openings are at the firefighter level, and most of all the police officers are at their police officer entry level. And so if they get large cadet classes, they fill that lower rank. Even if I had 100 cadets come into my class, I don't have positions that they could go into.
Thank you. I was pleased to see the 12 graduates yesterday, and it was exciting to see them, and hopefully we can honor a next much larger class soon. Thank you.
Yeah. Thank you for coming out, Ms. Alter.
Thank you, Councilmember Alter, for your thoughtful questions. Councilmember Ellis?
Thank you, Vice Chair Kelly. What possibilities are there for larger cadet classes? Is that something that is being looked at, and is it a trainer's availability or facility size issue?
It's not a trainer or availability of size for us. There are some conflicts we occur at the Public Safety Training Academy between when all 3 academies are going, especially in the use of showers and bathrooms and things like that, when all of them are trying to do PT in the morning. But we have 2 large classrooms, and we have the ability to run 2 different academies back to back or overlapping within our existing space. And when we have the training staff there, but our real pinch point is I can only hire so many in, knowing that they have to have, when they transition from a civilian cadet, they have to have sworn medic positions for them to go into. And so right now, again, I have 47, plus the cadets that just graduated, so I have about 36 that I can only hire into right now.
Okay, thank you for that. And then what strategies are being utilized to try to recruit trained candidates that might be working nearby, not for Austin, but trying to fill some of those higher positions with folks that are trained to work at that level?
So that's one of the things we talked about, and we talked about it last negotiating process, and we're discussing now, is that hiring straight into the clinical specialist level. Because people who are working currently as a paramedic or advanced life support, we've received a lot of feedback. They may not want to come to Austin and work at a basic life support and then wait 3 or 4, 6 months to move up. They'd like to come straight in from what they're working at and come straight into the department at that level. Currently, that's not an option. We are hopeful in the future that would be an option, that we would be able to then take some of the people that are either locally working in other areas around us and would like to come and work at their current level of advanced life support. Many of them worked for many years as a paramedic, and for some it seemed as a downgrade to come and work at a lower level for some period of time. Although that's very short, because through our academy and promotion, our clearance process, you only have to be cleared to the field for a few months before you can sit for the test. Traditionally, under civil service, it's a 2-year waiting, but through contracts and other things, it's really, as soon as you're out of the academy, you're cleared to independent duty, which could be 3 to 4 months, you can sit for the next civil service test. So we've taken that off the table as far as a waiting, but again, some people want to come straight in and work at the advanced life support level.
Thank you for that information. I appreciate it. I know we had discussed it in the last budget cycle, and so thank you for revisiting that with me and jogging my memory.
Yep, thank you.
Thank you for those questions, Councilmember Ellis. I've got Councilmember Vella up next with questions, and then we'll get to you, Mayor Adler.
Very basic question I'm trying to familiarize myself with. So the starting rank at EMS is what?
A medic.
A medic. And what do you have to have? What kind of certification do you have to be a medic?
So you have to be at least an EMTB, which is an EMT basic. There's 3 levels. There's a basic, an advanced, and a paramedic. And you can be any one of those, but you at least have to be a basic certified by the state. That's one of the differences we see in our 3 departments between Austin Fire and Police. We already have people, we search for people who have already chosen this field. And they're already certified, and we require a year of experience. So in the other departments, I know they hire, no certifications or qualifications. Then you get your TCLOS through the APD, through the academy. In the fire department, they have to become basic certified. They provide that for them in the academy, along with their fire certifications. So we are hiring people who have already self-selected this field as their passion.
So you're hiring basically EMTBs.
Yes.
And they receive their EMTB where? Where do they get their education? Where do they get their training?
They can get it through ACC offers it. There are also local fire departments all over the area that do EMTB certification classes in-house. There's Texas State Technical College. There's EMTF up in Pflugerville Georgetown. There's several places that offer EMTB classes.
And how long is the training? What does the EMTB training consist of?
Well, through ACC, it's a full semester. They provide other courses to make it a full semester course. It's truly only, I think, about 120 hours. It's 80 hours of didactic classroom, and then another 40 or 60 hours where you go ambulance rotations, rides, and ER visits to get your what's called clinical, and then you have to sit for a state test. So it can be very short and fast, or it can be extended out depending on the course and place you choose.
And when you're hiring people who are EMTBs, then they go into the academy?
Yes, our academy is not to really teach them EMS or EMTB skills. It's really we do onboarding, HR, those type things in the first few days, and then we're really teaching them operational issues on how we operate here inside of Austin Travis County EMS. And that's why our academy is only 8 weeks long versus months as either Austin Fire or Austin Police.
Okay, and then the promotion that you were speaking of, can you explain that and what the different category, the different levels are?
Yeah. So our entry-level rank is a medic, and you come into either medic communications or medic field. It's 2 separate paths. The next rank promotional is clinical specialist for either field or comm. Then we have captains. Then we have commanders, division chiefs, assistant chiefs, and chief.
And what does it take to become a clinical specialist?
In the field, you have to be a paramedic. So if you come in with your EMTB, you will not be eligible for that promotional test. That's why we're doing an internal class on our own to try to transition people internally, where we work with the schedule so they don't have to go somewhere else and then work around our schedule. We work with their schedule here and put them through the class. We've done 4 internal classes already, and we're doing 1 now. So they have to be a paramedic. On the communications side, they do not have to be a paramedic, and we have people that promote as soon as they are eligible, and they promote to the clinical specialist communications.
And what is the difference between the field and the communications, the job descriptions, functions?
So in the communications, the medic handles all the 911 calls, triage, and providing pre-arrival instructions. At the clinical specialist rank, they're able to do that and do our radio system. And so they're actually doing the dispatching, following up on units, ensuring staging is done, providing information, following up with Starflight, if Starflight's necessary, all the first responders that are out there in the county. Those are the different job duties. In the field, you're handling either basic life support as a medic or advanced life support as a clinical specialist.
All right. And in terms of filling your vacancies, what is the biggest barrier right now?
I believe the biggest barrier is our gap at the clinical specialist rank, just because of the way they've come to us. I mentioned the 2 units of CHPs that we had. We also had 8 clinical specialists added for our clinical consult line. And then we also got promotions as commanders, which all pulled from those middle ranks. So that is our biggest issue right now, is how we fill those clinical specialists. That's why doing the internal class, be making them become paramedics so they're eligible to sit for the next test or future tests. And then possibly, hopefully, if it works out, is hiring directly into clinical specialists from the outside.
And so it's a middle rank. Again, I know you mentioned that, but that's where the problem is.
That is the main problem. One of the things I will be talking with Chief Luckritz as when he comes in is how we can do that. And, we certainly welcome his ideas on how we might be able to fill those things. If we get to the point where we're still waiting to fill those gaps, there are some options we may have, and it would be to reclass those positions down and then allow us to hire into them, and then as attrition happens, move them back to where they were supposed to be. But that takes several options, and it's a lot of paperwork, and it takes a council action because of the classification ordinance that's passed. But I have to have vacancies at the lower rank to move people in and then promote, because the current process is going to take a long time to fill that middle rank.
Okay. And the final question, the pay for a medic versus a clinical specialist, what just, again, I know there may be ranges, but estimates.
I'm trying to remember off the top of my head here. I believe our entry level for a medic is, I think, 19. I don't know off the top of my head for clinical specialists the rank, but there is a gap between the two for clinical specialists.
Okay. Thank you very much.
Thank you, Councilmember Vella, for asking those insightful questions. Mayor Adler, it's your turn.
Well, I appreciate the conversation we've had so far. Chief, thanks for being with us. My understanding is that we'll see how the numbers actually work out, that the vacancy level is actually higher in EMS right now than in fire and in police, even though, a lot of the conversation in the community centers on APD. So obviously something that we need to be able to work on and fill. What has been, Chief, the roadblock thus far in getting the ability to bring in people at the level they might already be trained for, if that would help us most quickly deal with the vacancies?
I think the best way to answer that is what we discussed already, and that what's been discussed in the negotiations, is hiring into that promoted rank. Again, there are people who want to continue to operate and utilize their skills that they've spent many years training on and providing in other communities at the ALS, Advanced Life Support level. And so they want to come here and do those same things. And I think we'd be able to attract some people from some localities around us that may want to come over at that level instead of coming in at our basic level.
But the issue then is a contract issue with respect to, is that the?
It is a contract issue, and it's a civil service basic issue, first of all, and the contract would help us go around that civil service issue, yes.
Got it, I understand. Those are all my questions. Chief, I just want to say that I really appreciate your leadership over the last year and a half, 2 years of EMS. It's just an incredibly difficult time with so many things in the city, but the challenge that's been presented to our first responders, EMS, you and your force, just extreme. And I just wanted to thank you for your leadership over this time.
Thank you, Mayor.
Thank you, Mayor. I do have a couple questions. Thank you very much for that very informative presentation. The last time I reached out to your office, it was regarding the inability to staff units due to COVID. Do you have any issues now staffing medic units because of COVID?
We do not, and it's not because we're not affected by COVID. It's because of the specialty pilot program we're using to incentivize volunteerism. And what that is we're paying 2 times their salary if they volunteer to come in to work on their own, not, required off of any kind of list. And so we've been able to keep all our units up, keep our community health paramedics on the street because we were even pulling from them if we had to keep units up on the street. In other areas in our admin, like this current academy, we shut it down for 2 weeks because we didn't have enough staff to staff it. So we've been able to keep our academy where they're going, our community health paramedics in continuing their care to our community, and all our units have been staffed.
Where does the budget come from to incentivize those employees to come in
We're-
at 2.5 times their salary?
Well,
or
it's
their
just
rate?
two times
2 times,
their
okay,
salary.
sorry. I must have misheard you then, thank you. Where does it come from?
Yeah. It is coming from our our current budget, and we're evaluating that as we go along to make sure we have the budget for that. We do have vacancy savings because of the openings that we have, so we're able to do that. I don't know that we'll do it long-term. That's something we'll have to assess and everything, and then we'll see what comes out of any negotiations and stuff on pay and stuff.
Okay, do you see any challenges you're facing currently with retention at your department?
The effects of COVID in 2 years and, a severe ice storm last year and, some almost, traumatic issues this year. People were already starting to get a little PTSD just about this most recent ice storm. They're tired, they're worn down, and so it's I think it's across the industry, across the nation, in every kind of workplace you see, people are retiring, finding other ways to, have an income, live their lives and things like that. So I expect we're still going to see some retirements and some people leaving. That's why I'm still guessing we're going to be probably at about 10%. Depending on what comes out of the contract, that could incentivize some people to stay longer if they're already, at the higher ranks, because our current steps and pay scales only go to about 20 years. So that could be a positive impact for those that are already here, and maybe they'll stay longer.
Thank you. I want to open up the floor to you if there's anything that you might want to mention or say in regards to this presentation or anything at EMS that you'd like us to be aware of that you may not have mentioned already.
No,
Nothing else you'd like to add to the presentation?
no, not to the presentation. I just thank the council, mayor, council, and Mayor Pro Tem for, it's been honor to serve and continue to serve the department, and I appreciate everything that the council has done for us.
Thank you. I want to follow up with that and really echo the sentiments of the mayor when he said that we appreciate your leadership. It has been a tough time to work in EMS and public safety in general, and so we're very thankful that you filled that role and you did so with such great pride. We really appreciate that. Councilmember Vella has let me know he has another question, so he's
Sure.
going to ask that.
Not a problem.
Do you think the $19 an hour starting pay is enough?
I believe we're competitive, but we need to be more competitive. People are making a choice between us and Williamson County. We pay about the same. On average, they work a little different schedule. They do a 24/48, which is kind of a normal schedule for a fire department. We do the 24/72, but if you're going to make the same amount of money, they work less calls in a day. Then our system's very busy, and so they're going to make a choice what's better for their lifestyle and everything else. And so I think we need to be really competitive, and I believe there will be some positive things come out of negotiations.
Thank you very much.
Okay,
Thank you, Councilmember Vella, and thank you again, Chief Brown.
Ms. Alter.
Oh, wait. Councilmember Alter has a question too. Councilmember Alter, go ahead.
I just wanted to.
Oh, no, Councilmember Alter, we can't hear you.
It's very quiet again, but it was fine earlier.
Like my magic. You hear me now?
You are very, very quiet, ma'am.
Okay, I will be super quick and I will shout, I guess. I just wanted to thank Chief Brown for his service leading EMS. We spoke yesterday at the graduation about how your medics and EMS focus on problem solving and caring for our community. And you have demonstrated that as a leader through some really difficult times. So thank you.
Thank you.
And hopefully you heard that.
Yes, thank you, Councilmember Alter. And thank you again, Chief, for being here. I really appreciate it. Could you make sure that I'm on the list for when the graduation happens next time? I'd really like to attend to support your department.
Absolutely.
Thank